much for joining our panel discussion today with a very interesting topic, healthy eating and weight management myth-busting by experts. This event is a collaboration between the Alumni Relations Office and the Nutrition Program at the Department of Natural Sciences and the School of Arts and Science. I would like to take this opportunity to thank my dear colleague, Dr. Hassan, Professor of Food Science and Technology, and who also serves as the Director of Academic Compliance at LAU, for putting together this panel and for moderating the discussion. I would also like to thank our panelists, my dear colleagues, Dr. Nadine, Professor of Nutrition at LAU, Dr. Khoury, Malhame, Assistant Professor and Program Lead of Psychology at LAU, as well as Dr. Khoury, Clinical Assistant Professor, Division of Minimally Invasive and Bariatric Surgery at LAU Medical Center, Hospital. A big thank you goes to our alumni dietitians who are offering their time for pro bono consultations, namely Rena Atad, Rasir Amlouj, Myriam Radwan, and Noor Web. Finally, a huge thank you to my dear colleagues at the Alumni Relations Office, Mrs. Ghada Majid and Ms. Manwar Amnoun, and not to forget, of course, Pierre and Adil for their support and help. Dr. Hassan, the floor is yours. Thank you.
Hello everyone. Thank you all for being with us in this panel discussion. My name is Hussein Hassan, as Mr. Al-Khal introduced me. I'm part of the nutrition program at the American University. We have with us renowned panelists who will join me in this panel discussion entitled Healthy Weight and Weight Management Myth-Busting by Experts. So we have Dr. Nadine, Associate Professor of Nutrition. We have Dr. Myriam Khoury, Malhame, Assistant Professor and Psychology Program Lead. And we have Dr. Khoury, Clinical Assistant Professor at LAUMC-RH. Recently, every one of us became more and more So recently, all of us became more and more health aware. We face daily decisions on what to eat, how much to eat, when to eat, how much physical activity we need in order to stay healthy. And many of us try several diets because we rely on, unfortunately, false and fake information from social media and different sources. And that's why all these diets and all these misconceptions didn't get anywhere. Maybe because we are buying into common misconceptions about weight loss. So that's why we are here today to discuss all these myths in order to get take-home messages that we can implement easily for our better health. So I collected few myths from here and there, and I would like to start asking our panelists about them. Then we will take your questions. I know that many of you have interest in this topic because, again, nowadays everyone wants to be healthy following the pandemic. Everyone wants to boost their immunity. So this is why we are gathered today. So I'll start with Dr. Nadine, being the first to my left. Dr. Nadine, from your experience, there are too many diet myths, and especially in our Lebanese culture. Can you tell us, from your experience, like the top 3 ones?
Okay, so first of all, thank you for having us. Thank you for organizing Yes, our field, the nutrition field, and not only Lebanon, everywhere in the world, there are so many myths circulating. I mean, if you Google nutrition or diet, or if you go on social media, I can safely say, eyes closed, that at least 80% of what you read is pure nonsense. But you can read that I'm saying another word in my head. So I would say, if I had to say the top three in the past years, there's the classic one, which is that whole wheat bread is less fattening than white bread, for example. So they say khubz al-régime, you know, and this is absolutely not true. So whole wheat bread is healthier because it contains fiber, so it's better for our digestion. It can make you feel fuller longer, but in terms of calories, it's exactly the same. So that's, for example, a very, very common nutritional myth. There's a recent one about cow's milk being so bad for some reason. I don't know why. So everyone is paying so much money and to get oats milk, or oat milk, or soy milk, almond milk, and everyone has these sensitivities. And if I'm giving my daughter cow's milk, I'm a murderer and I'm a bad mom, and this is absolutely not based on science. So if you look at the composition of cow's milk versus the other types of milk, it's as good, if not actually better, unless you do have a clinical allergy or sensitivity that is proven by a biopsy or actual medical tests. Would you like to take a third myth? I have some in mind, but if you have one, maybe a psychology or bariatric surgery related myth, I'm sure.
Like one very common in Lebanon, I think it's related to psychology. When we say, for example, العين تاكل قبل الدم. Do you think it is like بالضبط? So is it true that color, shape, presentation of food do affect our eating habits?
Smell you're adding, right? So in general, hunger cues, I'm going to say, are multifaceted. So some of them are biological, and you have a cue when you're hungry, now you need to eat, while others are not. And usually they're multisensorial. So as you said, some things related to sight. We spend so much time organizing, and when we're cooking, preparing the dish, but then we eat it in like a minute, and that's it. The smells obviously come in, especially when we're hungry, and this becomes even more inflated. There has been lots of research, by the way, on the music, the background music. Check in restaurants, they always play these nice musics in the background. Then come in, it influences the types of food and the quantity of food that you're going to be ordering. The size of the plate matters as well. So if you're giving larger plates, smaller plates, we've all experienced this ourselves. Come in when we're with people around. So not only the actual environmental cues, also who you are with. And this is not, we're not saying that it's bad to eat brakas. We're going to maybe talk about some other myth as well, and you will see the nicest thing is to have people around that they regulate all of these cues. But كمان when you are with people around you, sometimes you tend to overeat كمان لأنه you're seeing everyone eat جلا. هلا كمان if you are at your grandma عيب ما فيك تترك شيء بالصحن لازم to make sure إنه because she cooked it with so much love, etc. This is not a myth, but obviously we tend to override biological normal cues, right? Natural cues. And again, it's not, we're not saying, I don't want to sound like I'm saying it's a bad thing to eat with people around. But when you're lonely, actually your eating habits tend to be even worse.
Yeah.
So better overeat with people and enjoy than to overeat alone and yes, and your mood is going to suffer.
So speaking of this, many of us overeat out of boredom. Is it accurate that when you are bored, you tend to overeat, or it has nothing to do with your state of mind in this regard?
Let me take a helicopter view on the field that we call emotional eating, that I'm sure you have experts in the field as well who can comment. The thing with emotional eating is you're eating not to satisfy a biological need, but rather to soothe emotion or calm emotion or regulate emotion.
Comfort food.
They could be positive emotions. تعرفوا بلبنان we celebrate almost everything. ديجا كل الأعياد كل عيد عنده special food. Okay, this is amazing. It's not so I don't want to say it's good or bad, but this is like emotional. So بنعبر عن طاقة المحبة لا بالأكل. بينجح البروفي بينجح الباك بينجح هذا كل ال celebrations they come with yummy food. Okay, ونعرف which type of food بالتحديد يعني food and drinks obviously we're saying. Okay, so positive emotions, negative emotions as well. So boredom, anger, frustration. هلا الطرقة بالnegative emotions إنه they come at times where your rational brain is less capable of regulating. تعرفوا we have, I'm not going to bore you with neuroscience, which is my field, but anyways, you have rational brains, wholly voluntary, controllable, and then you have emotional brains. They're two consultants. Okay, مش devil و angel. لا, اثنيناتهم they're very important in decision making. Because obviously emotional is non-controllable, automatic, etc. هلا when you're bored, when you're emotionally eating, automatically it means إنه rational مطفى والemotional مدوّر زيادة. Which means إنه your capacity to control it is going to be less accurate. هلا automatically what you eat is أولاً what you crave, but also what you learn to eat. يعني نحن بنتعلم either from cultural مثل ما قلنا هلا، okay, أو from the media أو from TV أو from shows. إنه when you're depressed, you take it out on huge buckets of ice cream. شايف؟ Okay, this is not what you eat when you're bored. When you're bored, بتفقد بزل مثلا أو popcorn أو شيء. So it's true that specific profiles of emotions, مثلا boredom, anger, blah 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 blah, they have been associated with specific patterns of food. Unfortunately, most of them are unhealthy. You're not going to bring a jar of strawberry or cucumbers out of the obvious. It should go
Let me add something about the behavior of eaters. For example, sugar eaters, veg eaters, golden eaters, depending on such every patient coming with problems. We have a lot of cases of, for example, sugar eaters, and we perform, for example, laparoscopy gastric sleeve doesn't work. Very important to know our patient before do any kind of surgery. Very important, the psychology.
Speaking of this, I'm sure you face this decision all the time. Like people coming to your clinic asking to do a bariatric surgery. So people in Lebanon think that no need to go for a diet intervention. Let's go directly to the surgery.
And even after the surgery, they
It is
think that they can go back to their
wrong to
habits.
do that. But before to ask, what is the definition of bariatric?
Yes.
Very important. Who know what is the definition of bariatric?
Bariatric surgery.
Why not obesity surgery? Bariatric, pediatric, it is a treatment, but it is a treatment of the pressure, of the weight. Obesity, it is part of bariatric surgery. Then before to perform any kind of surgery, we should know about the metabolic surgery, the bariatric surgery,
What's
the obesity surgery. The difference is bariatric is for the pressure, the weight. Metabolic surgery for the metabolic syndrome, for the diabetes. Then we can treat surgical, we can do surgical treatment for the diabetes, for example. Whatsoever the BMI related, for example, for the bariatric surgery.
So
Very important to know.
There is no one surgery that works for everyone.
Before to do it, we need to have a teamwork assessment. Bariatric center, for example, we need a medical, paramedical element to perform and to decide what kind of surgery will benefit for each patient.
Yeah.
Very important. The psychology, for example, you know, for example, we have, for example, patient sugar eater. Doesn't work with, for example,
So
with
refer them to a psychologist.
Actually, very important. Or failure of some kind of surgery. For example, with your patient, Hakim, I performed sleep vasectomy, no weight loss. What is the problem? We refer to the psychology. Sometimes we have a type of surgery of eaters.
Gastric banding. I always hear from people around me that it is the safest bariatric surgery
completely wrong. It
procedure.
is the most dangerous kind of surgery.
Why is that?
When you perform gastric banding, it's all technique.
Can we first introduce
The banding is the ring, yeah.
No, gastric band, it is a band. All techniques, we have a celastic, a gastroplastic, straightening of the stomach, and we put a caliber for the stomach. It is خلاص, it's finished. It is خلاص. Gastric banding, it is a rare indication actually to do it, because the gastric band, it is a band related to the chamber, and we inject, for example, deflate and raise the stomach, depending on either type of sedation.
What is it in Arabic?
ربط المعدة.
Okay.
هذيك برز المعدة.
So people usually think that ربط المعدة
It is not so
best.
safe.
It's
Now,
not.
gastric band, it is foreign body. You can have a complication, for example, slippage, perforation of the stomach, infection, a lot of complications.
So this should be the last option in
It
bariatric
is not
surgery.
indicated at all now. And in some cases, for example, for the patient or with high risk of anesthesia, for example, we need to do as soon as possible the procedure without side effects of anesthesia and complication, cardiac patient, high risk of complication.
So when you get any patient, or if any of the audience are interested in a bariatric surgery, do you, for example,
Yes.
get the
They
BMI
might be
first?
Bariatric doesn't mean metabolic.
Yes.
Completely different.
Okay.
We have the bariatric and metabolic surgery.
Okay. So for the bariatric, those who have extra
Wait,
obese, let's say.
morbid obesity. What is the definition of morbid obesity? I mean, very important to know. It is overweight plus comorbid. It is the definition of morbid obesity. Why are morbidity or morbid obese? It is obesity plus comorbidities.
Morbidity.
When comorbid, for example, patient presenting with overweight, with hypertension, dyslipidemia, sleep apnea syndrome, it is morbid obese. And obesity, it is a chronic disease. But by definition, obesity, it is a chronic disease, morbid obesity. You cannot treat it. You cut a little bit this vicious circle at certain point.
So in this case, because I know, for example, in Canada, the surgeon cannot do the surgery unless they get an official report from a dietitian that the diet didn't work.
Very important is the question. أول شيء, before to do any surgery, we need at least 3 consultations of psychiatry before surgery. Why? That is because there is a risk. We have a absolute contraindication to do any kind of surgery. For example, patient toxic addiction, toxicoma, for example, heroin, cocaine. We need a psychologist and psychiatrist. Patient chronic alcoholic. I mean, we need the psychiatrist to refer to be referred to the psychiatrist. Patient psychotic. There is difference between psychotic and neurotic. Neurotic, for example, any patient depression, it is neurotic case. That's bipolar, schizophrenic. We need to do any kind of surgery, the clearance of the psychiatrist. 1. 2, to know what is the kind of the surgery. Is the patient of eater? It is binge eater, volume eater, sugar eater. 2. 3, the patient, it is diabetic or not diabetic. It is diabetic type 2, at least for example 5 years, refractory to medical treatment. We need to go to the surgery and to do the metabolic surgery.
So is this protocol being really implemented?
Yes, أكيد, of course. In Lebanon, كل البيشنت بروح على psychiatrist little bit ما له مضبوط. بس أنا لما بيجيني patient بقول له please if you have little pill ممكن تموت لأنه هالكلمة تموت ليه؟ لأنه very dangerous. For example, يجي patient عم يعمل addiction على الكوكايين for example. You are not allowed to do any kind of surgery before the clearance of psychiatrist.
بس I think إنه هيدا الشيء بس
ما بسمع.
إنه I think إنه القصص اللي عم تكونوا مثلا طالعين بمستشفى رزق أو
It is any kind, we need a bariatric center. Bariatric center يبقى له psychiatrist, psychologist, يبقى له nutritionist, يبقى له gastroenterologist, intervention radiologist. We need a team, medical and paramedical, to do any kind. عم نحكي عن perfect la perfection pour بنسويه يعني.
That's why.
The idea is indication for surgery.
That's why awareness is needed, so that patients do not go for any hospitals unless they make sure they are taking this holistically.
نحن بالNAU نحن وفي معنا زميلنا الدكتور شمال والدكتور مسلي before to do any kind of surgery we أكيد نحن center it is universal center بنطبق البروتوكول عندنا باك اب اذا عندنا any kind of surgery and complication we are عندنا referral for example ICU we need intervention radiology كله هون تيم ورك كلمة هيك وقت تسمعوا بصير في mortality ب another institution لانه it's not well prepared او well ما في عندنا باك اب بعطونا البيشنت الريفيرال اللي عندنا لهسه بنسمع بالكومبليكيشن بالفيستولا بالمال مانجمنت ب another institution so very important sorry
Dr. Nadine, one myth that I always hear among people who want to lose weight. So they say, okay, we're stopping all the unhealthy items. We can eat healthy foods as much as we can because healthy foods do not result in weight gain. What do you comment on this?
Yes, I'm very familiar with this as well. First of all, I don't really like to label foods, healthy, unhealthy. Of course, there's a range. There are foods that are healthier, that are better for health, but eliminating having bad foods that you can never ever eat, this is something that is not realistic, that cannot be maintained. It's all about moderation and balance. But yes, there's this big confusion, and I always try to make it clear to my students, people who sometimes show me their blood work, etc., that healthy does not necessarily mean that you can have as much as you want. And the classical example is olive oil. So we all know that olive oil is so healthy. It is. This is not a myth. Olive oil is cardioprotective. Okay, so it leads to cleaning up of cholesterol from our arteries, and it's great. It dumps it in the liver, wonderful. But olive oil, like any other oil and like any other fat, is 9 calories per gram. 9 calories per gram. So what happens is that I have this classical person with hypertension, high blood cholesterol, that goes to the cardiologist. They might have had an incident, and then they learn that olive oil is so healthy and it's beautiful. In Lebanon we have olive oil, we put it on tabbouleh, on almost everything. It's amazing. And then they come and tell me, أنا عم باكل كتير صحي، ليه عم بنصح؟ ما عم باكل شيء, it's so healthy. عم بحط olive oil on everything. Yes, olive oil is very healthy, but 2 tablespoons per day is all the health that you need from olive oil. The extra is fat, and it's extra, and you can actually gain weight. So you always have to distinguish between the two. And yes, eat the healthier items, but nothing in unlimited quantity.
Dr. Myriam, when it comes to disordered eating, people think that it is restricted among females, because this is what the social media portrays. Any studies about gender differences when it comes to disordered eating? Do males get disordered eating?
If you had asked me that question maybe 10 or a couple of decades ago, the answer would have been yes, it's a myth, and it's mostly females who suffer from that. But males have been picking up the trend in the past couple of years. We're talking about how social media influence disordered eating. They have been common, but I think with the globalization, modern lifestyles, we're inflating those, and they're becoming more common. Unfortunately, we have to say that males are catching up quite rapidly with the trend. As Nadine said, so some trends start off as like healthy trends. So because we have been exposed to so much food porn on social media, then we started, let's say, with the healthy trend. Let's post the health food, fitness, food. But even when that became an excessive obsession, it also became problematic, and we saw the emergence of a term like orthorexia, which is ideally an obsession that would help the eating. So as Nadine was saying, كل شيء بيصير extreme, بيصير مهووس, بيصير you're eating only one type of food and you are constantly concerned about دي اوعى اكل من شيء ثاني او الكينوا يعني بيصيروا ترند اوعى البرغل ما بقى يسوى هلا اوكي مع احترامنا لكل الفود تايبس اكيد. I mean it becomes when it becomes excessive, obviously it becomes problematic. هلا you're right to say women are still more susceptible, but males are as well. This is because كمان في عمر معين. There's an age group where young adults, young adolescents are more susceptible to this image that is portrayed, these ideas that are portrayed. كمان ideally, okay, these want to promote more healthy eating as opposed to excessive obesity, etc. But كمان excessive thinness is nothing close to ideal, nothing close to healthy. So نرجع نوقع بالtrend المعين. And this has been unfortunately portrayed a lot in social media. انه الرجال كله لازم يكون مقسم كذا وهيدا. So this leads to lots of bullying if you're not compatible. But also at the same time, and I'm sure we've all experienced that this leads to lots of shaming when you're eating. انه تبقى انا علي حق اتهنى حبة الشوكولا. اوكي مش بالعلبة بس انه it's nice to enjoy this حبة شوكولا من بعد نهار طويل or biscuit. But when it becomes excessive, it becomes problematic. The problem that you are referring to is this line is becoming blurred. So even when you're eating like a bit of candy or a bit of cake or a bit of هيدا, you're shaming yourself. لا عيب شوفينا هلا ما بقى summer bodies, etc. So it is common in both males and females. Some much more commonly طبعا in females than males, except maybe binge eating, which seems to be.
That's what I was going to say, and I'm sure George agrees. Among his patients, I mean, emotional eating.
It's always eating very, very difficult situation.
Especially, I've seen a lot of males, for example, especially in light of the recent crisis, who left the country to work and their family stays here. They're used to having their wife cook for them, etc. They find themselves lonely, far from their family. They're not used to preparing food, and then comes the binge eating, and then comes the bariatric surgery.
But speaking of this, is this reflected as well in the surgeries, like female to male ratio? Is it similar, or it's more
similar? It's similar. I think there is no difference between gender and.
But do they come all the same?
Yes.
For surgery, it
Yes,
says
yes.
half.
So I think this complements what
Around
just said.
maybe 60, 40, 60, depending.
Age group as well. Age group.
Age group from pediatric ages to older patients. I already underwent laparoscopy surgery for children 12 years
Wow.
for metabolic syndrome, severe metabolic syndrome. أكيد after clearance of pediatric consent or assessment. Order even with patient 75 years recently. I performed surgery 2 months ago for patient 75 years or female already with severe comorbidities and already catastrophic.
But at this age, would
Yes,
the
we can,
intervention
there is
be
no limit
effective?
for age to do surgery.
So it will stay effective at this age?
There is a relative contraindication for surgery. For example, complication of anesthesia, cardiac problems, lung problems. But even if there is a clearance, you can perform for any ages. There is no limit or no contraindication to do surgery, for example, a boy 12 years or 10 years, depending. There is a balance between complication and states of sedation.
As they usually say, if the likelihood of the surgery, the risk of the surgery is less than the risk of staying obese, then it is performed.
The risk of to do surgery, it is less than the metabolic status of the patient.
They keep their status. Let's take a couple of questions from the audience. Go ahead.
It's open.
sometimes وقت لما حدا بيروح عند السيرجن قبل ما يعمل بارياتريك سيرجري بينصحوا الدكتور انه انت جرب غير باللايف ستايل، جرب اعمل سبور، يمكن يمشي الحال ويمكن لا، بس بتكون حاولت قبل. اذا ما قدرت انه فينا نعمل سيرجري.
You are speaking about patient coming with BMI, low BMI. Low BMI, for example, patient BMI 32. There is an indication for bariatric surgery, not metabolic. إذا عم نحكي bariatric, completely different from metabolic. The bariatric for the weight loss reduction, there is a limit. We need إنه يكون عندنا BMI more than 35 plus comorbidities or more than 40 whatsoever the condition. بس إذا جاي
انا هون بس عم بحكي
نحن bariatric surgeon
اعلى.
ايه نحن بدنا كوزمتيك سيرجن. بيجي عندنا بيشنت انا بدي عندي كم كيلو بدي اشيلهم، لا اتس كومبليت بقول له لا فيلم. كرمال هيك وي نيد ا بارياتريك سنتر. البيشنت يشوف نيوتريشنست، يشوف سايكولوجيست، انه there is a cases of refractory cases. نحن عم نحكي عن الديزوردر اوف اوفر ايتينج. ديزوردر في عندنا ديزوردر باي ايتينج. فيري امبورتنت. اذا زي بي ام اي 36 وعندها comorbidities لا we can perform the surgery. بس at least انه يكون followed by psychiatrist, nutritionist و team of the surgeon.
The surgery should be the last resort.
اكيد اكيد.
مع انه as you said سن يعني it becomes a trend. انه يلا بنضعف اسرع والجارس مضمون ولا شو وجه قلب الدايت.
ايه انا the number of cases the number of cases يعني عندنا a number of cases. انا هذا الشريط بس اكيد very important to know انه bariatric surgeon منه cosmetic surgeon او plastic surgeon. انه تيجي انا عندي حدا بليز عندي 10 كيلو بدل لا غلط completely wrong. في another alternative. For example, for the low BMI, not invasive, for example, swallowing balloon.
Yes.
Very important. You don't need any anesthesia, and it is around 15 minutes, 20 minutes you can do it, and you can be.
But it stays for few weeks.
For 4 months.
4 months.
My colleague دكتور مسلم عنده دكتور شميل ودكتور مسلم بفتكر انه بيعملوا بالون. معك معنا من
Yes, I just have a question about the 12-year-old child. The 12-year-old child.
Yes.
Don't we have to wait until, let's say,
لا,
his
when-
puberty, the organs develop?
Very كتير برافو.
goes through-
When you are facing complications, for example, severe metabolic complication for a patient, kid 12 years ago with diabetes and metabolic syndrome and dyslipidemia and liver steatosis, MASH syndrome, you need to treat the problem. We are facing metabolic syndrome, severe metabolic syndrome. It is resistant to any kind of diet or any, actually we need the psychology. The psychotherapy very important before surgery and after the surgery. Then the patient to be well prepared. Became of BMI 45, صار BMI 30. Completely, he needs help. أكيد الhelp بيكون من nutritionist and psychology.
Okay, so بيكون
بس
better
أكيد
because of
إيه
diet.
عندنا balance between complication and treatment. شو بعملوا؟ نشوف
So
وين.
it's case by case.
Case by case أكيد under discussion and studying. Okay.
This is rare, but we're seeing this more and more.
Right.
Kids that have diabetes and that have a fatty liver due to their weight,
Yeah.
this is very severe.
It's a big
You're
case.
supposed to have years and years of obesity to develop that. So it's really an exceptional case.
Exactly. Terminate we difference
Life saving.
between bariatric surgery and metabolic surgery. Completely different.
But it depends on the process was
Sometimes it will take 6 months.
until they have the surgery.
لا before to decide any surgery, any surgery أكيد.
To try.
نعطيه physical activity, psychotherapy before to be well prepared after the surgery, nutritionist, protocol. يعني كلمة procedure. لا ده مش طالع عندنا يلعب العملية هيدي completely wrong.
I think you already answered my question here. No, it is, do you immediately go with bariatric surgery, just like you said, especially for pediatric populations? Well, do you immediately, مثلا, let's say, refer them to a psychologist, a family physician, coordination of care,
Exactly.
medication.
ايه اكيد كوردينيشن الكلمات لازم تكون على بارياتريك سنتر
لو حتى كانت metabolic
لا
surgery.
الكاينز بيدياتريك ايجز الادوليسنت يكون جميلة metabolic cases not overweight not morbid obesity. The patient عنده metabolic syndrome. It is kind of genetics sometimes, congenital or multifactorial problem. We need أكيد to discuss that issue with the paramedical team أهم من medical team. For example, psychotherapy بالنسبة لي very important before to do any kind of surgery. As a nutritionist, the role of the nutritionist very important, especially بالrefractory cases أو بالfailure cases. أنا مش على surgery على failure cases. أنا أعترف فيهم. الfailure cases بتكون not good indication before for the first step. مثلا patient جاي عنده diabetic or معمول sleeve. لا, he needs to do gastric bypass. لأنه بيكون sugar eaters. كيف بتعمل sugar eaters؟ كيف بتعرف إذا patient toxic or not؟ كيف بتعرف patient أي kind of eater؟ لو ما في psychotherapy, psychiatrist, nutritionist, the role very important to do any kind of surgery.
It's good to see that surgeons now take the nutrition and psychology
Very important.
seriously, because before it used not to be the case. Like the surgeon used to take the decision without referring to anyone else.
I think it is a failure, the risk of complication, as a risk of failure, without any help or any assistance by the team. I think that failure is 90% from this kind of patient. For example, I performed patient psychotic. ممكن بيجي اللي عنده bipolar يكون بكل ممتاز فجأة I performed the surgery. After the surgery, I found that there is a problem, a big problem for me. هون صارت catastrophic. هون صارت في risk of complication, risk of morbidity, death, sudden death. Very important.
Yes, it's me. Thank you first for this interesting talk, really. My question is that, do you usually prepare the patient for what he or she is expecting after the surgery, يعني the phases that the patient will go through?
After the surgery.
Yes.
أكيد very important. The patient needs to be well prepared before and after the surgery. We need bariatric center, teamwork.
Specifically regarding the diet that they
We need collaboration for the team.
Because I see many
sometimes عندي بيجي cases, refractory cases, مثلا عاملين sleeve gastrectomy after several years عاملين له weight regain ما بروح for surgery for example. لا, I found that something is during the discussion, the case with the patient, something is wrong. لا, I prefer to go بعمل له referral of psychotherapy. He needs help. Maybe يمكن أعمل له أخص من surgery بدون problem.
هيدي الفكرة إنه البارياتريك surgery هي الحل.
لا, that's
It's part of the solution.
It is
in case you are.
لأنه الأوبيزيتي it is a chronic disease. مثل diabetes. ما curable diabetes. أكيد بتساعديها. You can help. You can cut the circle at certain point. But you cannot treat it. هلا recently بنقول صار في عندنا surgical treatment of diabetes. بس يعني نعطي 10 years طبعا after 10 years انه بنقول اوكي يمكن نقدر نساعد هذا البيشنت بس ما لنا جارانتي 100%. It is 90% بس 10% patient. 10% sometimes very important. الفيلم طبعا بيجي ب 10%. Refractory cases needs the help برجعون مرة ثانية psychotherapy and nutritionist. Very important. إن الرول طبعا بيكون كثير مهم.
There's no change in lifestyle.
أكيد.
إذا بترجع وزدت الهابتس eventually the tissue grows again and everything.
Sometimes it becomes depression. بتعرفوا على depression العادية وفي عندنا severe depression. Sometimes severe depression توصلنا لمشكلة كبيرة بس أنا I can resolve the problem when I discuss the issue with my colleague, for example, psychotherapy. I can resolve the problem. يعني هلا بالبيت بتاعك إذا ما كان سنتر ما كان university center, the problem is here. لما تروح البيشنت بيروح على peripheral hospital not well prepared يلا تعال من فوق اللي عمل لك عملية. خلاص.
This is getting
هذا problem.
I read in the news 2 weeks ago, one young lady, 21 years old, she lost her life because of a bariatric surgery. Exactly, in a remote hospital because it was cheaper, but they didn't have the ICU.
The problem where the BMI it is 30. لأنه حكوا معنا البيشنت وأخذوها بعدين على UB. I refuse as a case. أكيد الكوليك طبعا يرفض. من 30 ونحن عم نعمل لها BMI 30 بانستتيوشن not well prepared. هون كاتاستروفيك، هون بساعتها بصير شغلة ethical. Ethical.
And awareness.
It's and ethical بصير. And ethical. Very important.
Just one more question about the classification of the surgery.
Yes.
According to my knowledge, they are bariatric surgeries and classified into malabsorptive and metabolic.
بس بدي ارجع صلح لي مرتين بعد لو طول عمر العلم. دائما عندنا بارياتريك عندنا ميتابوليك. ما فينا نقول بارياتريك او ميتابوليك. بيشنت عندنا بيشنت بيكونوا بارياتريك وميتابوليك، يعني بيشنت بي ام اي 35 ودايابيتيك. ميتابوليك سيرجري يعني مثل دايابيتس. مثل ماش سندروم. ايه هو التكنيك في عندنا طرق، في عندنا سيفرال كايند اوف سيرجري. في عندنا شيء بنسميه ريستريكتد بروسيجر جاستريكتومي، وفي عندنا شيء اسمه ريستريكتد اند مال ابسوربشن مثل رو او 1. بس ما بدنا نفوت بعدين في عندنا البي بي دي في مالتيبل تكنيك. بس كنا عم نحكي عن جاستريك بان، جاستريك بان it is indicated in small cases. وقت يكون عندنا patient higher risk patient of complication cardiac complication we need to go faster during the surgery بنحط له بان. او sometimes for example عندنا patient psychotic well prepared بس we need انه تكون نعمل له down staging the disease. I prefer to put a gastric bandage. مريض بيكون عنده توكسيكومان addicted حضرناه مع البسيكوثيرابي مع البسيكولوجيست مع البسيكاتريست بيكون ready for surgery. I prefer personally to go نسميها neo-adjuvant او down staging the disease. I put a gastric band. Some cases يعني بحطها مرة كل سنتين ثلاثة. But as I'm complication, I can remove delivery easily the band.
شوي بس anyways, my question is regarding هي شوي genetics and biology شوي. It's a bit of a large question, but see, what's the best diet for humankind? Usually مثلا ancestor wise or evolutionary wise, they say and usually animal sources are the best sources of nutrients and nutrients for the humans. Some people usually more modern days they say that plant sources are the best for the humans. That's why صار في veganism صار في حتى كمان animal diets somewhat like meat carnivorous diets for humans, which kind of brings up a new question: what's the best diet for humans usually? I know it's a very difficult question.
Okay, so a lot of myth in what you said, which is perfectly normal because we're again exposed to so much information and everywhere everyone is talking about nutrition and different types of diets. So definitely, if you wish, the best diet is a diet that includes everything, including animal products, but in moderation, especially when we're talking about meats, in moderation for various reasons. Because they're, again, in large quantities, they're associated with weight gain. The types of fat that you find in animal foods are fats that are usually less healthy for the heart. And for environmental reasons, I don't know if you are familiar a bit with the carbon emissions that come from animal foods and the greenhouse gas emissions, so which makes our growing population harder to feed because these animals produce these gases, use all of this land, all of this water, etc. So for health and for continuity reasons and environmental reasons, definitely a diet that is moderate in meat, but that still includes meat and animal products and plants, etc. This whole thing of our tell you what to eat is your body, listening to what your body needs. And that's why crash diets, for example, that eliminate completely carbohydrates, will lead you craving for any type of pasta, pizza, chocolate, whatever you see, because your body needs it. When you're actually able to listen to your body and ignore a bit all of these influences that Myriam was talking about, whether emotional or advertisement or social media or whatever it is, if you can really listen to your hunger, satiety cues, what your body wants, you're actually feeding it the best.
And here, let me highlight how the Mediterranean diet is being promoted. And the Mediterranean diet is based on
food.
plants with a small part of animal food. Exactly.
And some are when I think about all the كحمات اللي احنا بناكلهم on a daily basis, they're so complete, they have everything. And the health is possible. But unfortunately, our diets don't look so Mediterranean anymore. But we have the best food and the best fruits and vegetables.
But you know, nowadays, due to the economic crisis, people are going back to movie products, authentic products, because the imported stuff are no longer affordable. So I think this could be an opportunity to improve the well-being of people by going back to the traditional foods.
هلا أنا what I hear يعني when I hear someone say authentic or what our ancestors used to eat, I feel it refers to like processed versus non-processed. أكثر من إنه animal plant versus يعني إنه شوكولا بار شوكولا ولا والدبس.
Hey, this definitely. I'm sorry, I thought you were referring kind of to the paleo or the الخليات. But if you meant processed, definitely you're right.
Evolutionary wise and how they used to eat, I think it's genetically wise and passing of generations and genes and influence, this affects us حاليا since everything is processed by the
Absolutely, and what Hussein mentioned, on one hand, because of the economic crisis, yes, we're going back to Mune and our roots, etc., which is good, but at the same time, you have the cheapest products on the market are super processed and are very, very low quality. And this is why, exactly, and if you look around the world, the highest prevalence of obesity is not among the high socioeconomic status people. It's little lower. It's the person that has trouble to make ends meet, that doesn't have time to cook or to have perishable foods at home, fruits and vegetables and the healthy stuff, and that needs to go for quick, cheap fixes. And you see this in India, in the slums, in the little markets, and over here in remote areas.
In the states where you have poor socioeconomic states.
You see obesity
With soda
rates
it's cheaper
spike.
than water.
Exactly.
Exactly. Among Hispanic, dark skinned people.
Absolutely.
صراحة كمان هلا صرنا حتى إذا لبنان يعني إذا بتشوف أسعار الفيجيتابلز إنه صحن الفتوش صار أكثر أساسا مكلف.
تزرع على البلكون شوية.
بينما مايكل بحط لك أكثر
حد السر.
فإنه قد إيه في فرق بالأسعار.
And you might think إنه هيدا اللوبيا اللي أنا اشتريها بتكب a part of it. Exactly. So it's, if you look at the influences, it's easier and cheaper to make the choices that are less healthy and.
So, for example, dietitians advocate for white cheeses. Nowadays, you cannot bring white cheese to your place unless you have constant supply of power. That's why you see people going for spreadable, unhealthy cheeses because they don't have constant power supply. So this is another challenge that we are facing. But again, I always refer to the Mooney example because I'm from Bekaa and I know how Mooney is essential in our life. And in the middle of the economic crisis, we didn't see people starving in Bekaa because they all had Mooney. But you see like people in urban areas looking for products right and left to survive. Like in remote areas, they were happy, they were satisfied because they had all these healthy products. So this is
an opportunity to
exactly
promote
an opportunity, exactly.
Yes.
Yeah.
On the other side, the Mooney was one of the major causes of obesity.
The Mooney is
The
causing
major causes
obesity.
of the obesity, because all of those socio-economic countries, when they encountered a problem in their countries, they started putting Mooney and food in their refrigerators and elsewhere. And all of a sudden, instead of throwing them because the expiry date is close, they start eating them.
Yes.
And this was also the cause of this Mooney.
During the lockdown.
During
During the COVID lockdown.
Where people stopped working to consume them. We all did this a bit, يعني, to a certain extent.
So when you have a product near expiry, instead of wasting it, you will consume it. And this led to overweight during the pandemic. And that's why following the pandemic, everyone is going for surgeries, is going for life consultation. But from what I see around me, people go straight to the surgeons. And unfortunately, unfortunately, from what I hear, surgeons are not following the right approach that you
Exactly.
They
Post-op.
yeah,
The follow-up
but-
post-op, very important. When we lose our fish, then I'm خلاص.
Exactly.
Completely.
You had a question.
Exactly.
Yes, I had
Yes.
a question.
Yeah.
هلا what are we doing more, bariatric أو metabolic surgery?
Bariatric.
Yes, لا بس قصدك
Not
التايب
okay.
إنه بس obesity ولا ما؟
Depending each case, then every case needs to be assessed well before surgery. For example, patient, مثلا old patient female, 25 years old female, newly parisian, not married. We can ما بروح بعمل باي باس. We go to do شو sleep gastrectomy. Why? لأنه it is little paris. The risk of pro-OY بعدين later on not to get easily pregnant لأنه صار في عندنا deficiency بالفيتامين folic acid بالايرون. Every case need to be assessed by a team. يعني ما بيجي surgeon يعمل الابلكيشن أنا بدي أعمل لك هيك أنا بدي. لا. We need to discuss the problem with the patient, with the team, and بعدين after يكون عندنا كل الداتا we can decide to do what kind of surgery.
But this is you.
Okay.
We're talking
No,
about surgeons in general.
no, me and Dr. Salim and Dr. Shmei.
At LAUMC.
LAUMC.
We are
So
the
you're
best.
safe.
لا لا مش بس.
Outside
لا لا
LAUMC.
لا بس.
Don't
ما في
go
حدا
there.
بس. ما في حدا بس. بس هو اللي يعني هلا مريض. لا we need to لأنه البروبلم وين البوبولار كل الغرض. بالكاينز اوف سيرجري اللي عملوا بيونيفرسيتي سنتر well prepared not be another institution لانه ما في باك اب اني كهي ما عم نحكي كيس مورتاليتي بيت المريضه لانه ما في باك اب لانه ما في باك اب it is هون كاتاستروفيك هون البروبلم بنسميه unethical او هذا سيرجن بيجي بقول لك انا بارياتريك سيرجن لا هي كمان غلط بيعمل لك عمليه لوقتك بروح بعملها مثلا بصور او مش باين او ما بعرف وين ايه هذا البروبلم وفيسي
We have a question.
Yes, في أنا في
Okay.
nothing.
No, go ahead. Go ahead.
Thank you. Actually, I need two questions. My first is for Professor Myriam. You mentioned the effect of social media on obsessive eating among males. Do you think social media exposed or accelerated the emergence of obsessive eating? This is my question. My second question to Dr. Nadine. I would like to hear your take on weight loss supplements in regards to losing weight. We did not mention supplements. We mentioned some diets. We mentioned surgeries, but not supplements.
You're right to ask about more details about social media. The thing is, not to generalize, obviously it taps on vulnerabilities that people already have. So not everyone who's scrolling through social media is going to have a low self-esteem and hate the way their body looks, though lots of people do that temporarily. But it doesn't necessarily reflect in more severe dietary changes or behavioral changes. So those, you're right to ask, those who already have vulnerabilities, personal, psychological, social, environmental, emotional, they're going through a breakup, say قامت هلا, they're more susceptible to developing that. So it taps on vulnerabilities that are temporal. يعني انت وعم بتهلا you're scrolling, you might be more or less susceptible. ديجا اذا انت اكل او لا, this is gonna change. اذا انت مبسوط بحياتك او لا, اذا it's at 10 in the morning بعدك ببلش نهارك مسيطر, او it's at 10 at night محروق زينك مالك جديد حالك بقى باخر النهار. So there are lots of factors. كمان we became more aware of these numbers and we started doing more research on that. And I think Nadine can comment on that as well. يعني صرنا نعرف فيهم أكثر لأن we're interested in looking at that as well. لأنه reports are made public, لأنه social media platforms هن مجبورين to provide transparency, مع إنه بأول السنة كمان صار في خبيصة إنه خبوا الداتا قد إيه هن they're damaging أو لا, etc. Right?
Right.
Yeah, something or both.
Yes.
Actually, something that you taught me when we were doing the study is that you have like is your trait, what you're like usually, your body image, for example. Usually, you tend to have a good, to feel good about yourself. You can like yourself, and then you have a state. And what we test, for example, is after looking at an Instagram account with body transformations, you might. Although usually your trait is to have a good, positive body image and you're a self-confident person, but after looking at that account, if you've had also a bad day and you're pissed off and your money's at the bank, it's not coming out, you look at these images and you feel bad about yourself. So you have to distinguish between both, and definitely it affects both. But if your usual trait is not very positive, then it can affect you more. You're more vulnerable. Now, your question about supplements. So you were my student, and I know you will not agree with me.
And you were.
But I'm a scientist, and so we need to distinguish between supplements and medication first of all.
Yes,
So your question is about supplements, and from my knowledge, from what I've read, and I've read on this topic, plenty of studies. You don't really have supplements that are legal, that and without very dangerous side effects that can help in weight loss. You have a couple of herbs that have shown some positive results on appetite, but really they are almost insignificant, and they need to be coupled with a certain way of eating and or exercising. So for me, supplements, again, not medications, don't really have that important role. There's no magic pill to help you lose weight. It's more of a waste of money. Again, I know you don't agree, but yeah.
I'd like to thank you all for doing such a great job, and you really are first class. And I want to thank you all for improving the quality of life of everybody, because by selective surgery and collective consulting, you've really stepped up things tremendously. You've stepped them up so much better that you've expanded the lifespan of the normal people. You know, we used to die at 50, 60, now they die at 80, 90, 100. So that means you've got a problem somewhere. Not a problem, but I have, for the past 10 years, found a lack or a finance with the information. I have not been able to find a dietitian to serve my age group. Yeah, let's draw the line at 60. Everything below 60, you're fine. You know, your body's working, you know, everything's in its right place. After 60, things shift and move and change. And I haven't found a dietitian to understand that, to help me, help her, help me. Seriously. So, I am asking the LAU team to please research, work, ask, find out. I'm a guinea pig. I'd love to help you. Find people above 60. Draw the line at 60 and above. Help us live with bodies we don't understand how they've shifted and moved and changed. Seriously, I wake up one day, I've lost my waist. I wake up one day, something's shifted in me I don't understand. I wake up one day, I don't have dinner, I don't lose weight the next day. What's happened to me?
It is very important.
Please open a research in your pediatric system to the center, and please help us. I'm talking for everybody 60 and above.
Although you don't look.
I am way past 60. I'm past 60. But I am still very much alive, and I'm ticking, and I really want to continue my quality of life. So, but I do need your help. I'm an LAU graduate.
No, obesity, you don't have a definition of obesity, it is a chronic disease. It is a chronic disease.
No, I don't have to be obese to come to you. And for me, I'm fatter than I was originally. I am a whole 10, 15 kilos more than I was. I don't want to be so, it's hurting my back, it hurts my knees to have all this extra weight on me. I don't want it, but I can't get rid of it. So I don't have to be obese to come to you.
Yes.
To be fair,
right.
When it comes to the nutrition profession, it tackles all age groups, and any nutrition graduate can cover all the age groups. But let me tell you what the problem is. The problem is the body image is more prevalent among younger age groups. That's why dietitians get exposed more to younger than 60.
I understand, that's what I'm saying.
But I can refer you to many of our alumni who can perfectly look into the case of anyone above 60 years old. And we have many of them here. And definitely on your way out, they will come after you and give you consultation.
We have something called in our curriculum. We have, of course, entitled Nutrition in the Life Cycle. So we are very aware of the changes, especially the body composition and the basal metabolic rate changes that happen with aging. And it's harder for females also because
no, males as well. They can watch it and they just shut it.
But if you think about it, in terms of shape, males don't change that much, so they tend to gain more weight. But females, they have more redistribution of their body fat. يلي بينقهروا كتير منه. And I have a mom. I feel like I'm talking to my mom because this is what she tells me all day long. She shouts on me as if it's my fault. so these are things that are completely normal. And definitely, I'm sorry that you spoke to people who were not able to give you the right advice and to perhaps understand and have the empathy to really understand your problem and adapt their medical nutrition therapy to your own concerns and what you're facing. But as Hussein mentioned, I'm confident that among our graduates, we definitely have some qualified people who can really understand and adapt their advice to what you are facing, and you are definitely not alone facing.
Thank you.
Can we take one more question? Yeah, sure.
So I'm just going to go back to the pediatrics population because it's a real concern among children. So we learn and when we have young children, it's best to promote healthy lifestyle changes, promote physical activity. However, sometimes their parents are pressuring. They want to see like actual weight loss on the child. So I just want to ask, from a nutrition and a psychological perspective, how healthy is it to put a child on a calorie deficit diet to promote like you have to lose weight, but نشيل الكرش, but نشيل البطن, from the nutritionist or the dietitian herself, and how can we best like communicate that to the parents? Like how can I say that in a like the most professional way possible.
Go ahead.
This is something that I'm very sensitive to because, and Myriam too, we work a lot on the psychology of sitting, and especially when you're talking about children who are building their character, their personality, their self-esteem, etc. So parents tend to make huge mistakes. And definitely when it's important for the child to have the right habits, and the first thing for the child to have the right habits is to have their parents have the right habits. When you're eating with your parents and they're on their phones, or you're eating in front of the TV, or when you see your parents all the time snacking in the house, you can't expect the child to do something else. When you see your mom constantly commenting on people, you can't expect the child to build good habits or to have a good body image. And telling your child that or that he's not good looking also is very, very bad.
If they have two children, they usually will bring the girl, not the boy. If they're both obese or they have like an overweight problem,
it's very, I'm sure for you, I don't work as a dietitian, but for you, I'm sure it's very frustrating to work with the parents. But I would say stick to what you believe in, to what you have learned, and try as much as possible to explain this to the parents. And especially parents are the role models of the kids. And usually, if you look a bit further, you see that the habits of the children are coming because of the habits of the parents. And over-restriction is so bad. If you tell your child you can never eat chocolate, he will go and steal from the supermarket. Or instead of playing with kids at the birthday, he will be at the buffet looking for candy or chocolate. And this will lead to weight gain, actually. And the reverse of
So parents are to blame, not the actual.
I'm sure Myriam has to add on this.
Hala, the thing كمان is that we need to factor in and respect where parents come from. And we also, this is another myth that Nadine mentioned before, okay, now I'm not happy with myself because I'm fat. When I will lose weight or go through the surgery, then I will be happy and then I will be satisfied. But the thing is, the surgery or the diet doesn't change anything about how you are happy with yourself. So usually what we try to do is teach the kids, مع الكرش, I'm gonna love myself as I am. I'm gonna try to improve it because I will be healthier, I will live longer, I can run after. And we touch on the pain points. Sometimes the parents, this is coming from a good place, they don't want the kid to be bullied. Okay, وكمان بالمجتمع there's more pressure on the girls to look pretty and nice. The boy can just do smart and be fat ما بيأثر. Okay, the girls عندهم هيدا الextra step بعدين بيجي الضفير والشعرات والمنسلة وهيك So this is كمان somewhere culture. So نحن بدنا نجيبهم شوي صوبنا without being كمان كتير cutting edge يا هيك يا هيك. Okay, so usually كمان as George mentioned, you spend more time talking with the parents. مش دايما إنه مش لازم يسمعوا بس the more time you spend talking with them instead of 10 دقايق على السريع ويلا. Then you can find common ground. مثل ما Nadine suggested. How about one meal without the TV? أو how about the TV at halftime? مش من الأول الميل. شوي تنجيبهم. And then you can suggest how about we involve the other child? How about تعال نخبر خيك أو خيك وين صرنا شو صرنا and draw a reasonable timeline. ما فيك تقولي للأهل اتركينا على فضاوتي أنا بدي ضاعف الولد وقت ما بدي. Try to tell them in 2 weeks expect this أو in 1 month expect this. هن رح يقول لك لا وكثير وكذا. This is where you can explain إنه ليش الشغلة بدها شهر تكون sustainable أكثر etc.
I just wanted to comment on the lady in front of me, a tip.
Hi.
Okay, hi. So usually, yes, you're absolutely right. This is a frustration that I have. I mean, usually they're more fixated on adults and on pediatrics, but geriatrics is also an important life stage. I've looked it up, and if you want, you can actually look for board-certified gerontological nutrition. Board certified gerontological nutrition by the Academy of Nutrition and Dietetics. Usually students take it an extra mile. Is ability to specialize. Okay, so that's something I might consider. This is one. Now I have a question for the panelists. I just need to ask, what is the best behavioral technique that usually in psychotherapy you've seen worked? يعني في grad about REBT, في CBT, في hypno CBT. Usually which eclectic, whatever, يعني which one did you see through practice, never mind the research, أكيد research is important, بس أكتر شيء بالعيادة that worked with you the most in terms of weight loss. ما ضروري obesity يمكن overweight.
Bravo, but you know that there is no one size fits all, unfortunately. ولا للdiet, ولا للsurgeries, ولا للpsychotherapy. The one that touches on your pain point. يعني في يكون حدا مش مبسوط بشكله لأنه they're not pleasing their partners. في يكون حدا مش مبسوط بشكله لأن they're not feeling seductive. في يكون حدا مش مبسوط بشكله لأنه she's not able to run after her kids. So أنت بدك تلقط the pain point. You don't want to generalize and say like someone is not happy with their body weight or with their body image for that particular reason. When you touch on the real pain points, this is where you can make them more compliant. So كمان Judge had mentioned compliance. إنه أنت مش بس عملت treatment وsurgery وراحوا على البيت وانتهت لأنه ما غيرنا شيء. The compliance is increased when you touch on these pain points. And what really matters, is it joint pains? Is it not being able to run after the kids? Is it not fitting in a seat on the airplane? So what is it really that matters for that one patient of yours? And usually you get that from interviews. And the longer you talk, you have conversations, active listening, this is what gets you there. And then of course you have lots of techniques, CBT, but you can start with very simple sleeping. When we're sleep deprived, we all eat more. And if I ask you, I think all of us will raise hands on sleep deprivation. Okay, so إنه في قصص كمان كتير basic, super simple that can also get you there, so that you start getting this compliance, وبعدين you work on cognitive restructuring, etc.
Last question. Thank you again for this great panel discussion. I think it covered everything. I just want to ask about, you talked about supplements and you also talked about versus medications. Lately, a lot of people have been taking Ozempic and they're saying it's a medication and even dietitians are giving it. Yeah.
Very important. There is a big deal between, and conflict, I think, between endocrinologists and nutritionists. Sometimes the endocrinologists play the role of nutritionists. It is completely wrong. I think the problem is here. إنه بيروحوا عندنا patient, بيروحوا عند endocrinologist, بلش يعطيه هو الدايت. Completely wrong. It's very important. يعني هلا عم نحكي between supplement وميديكيشن. ميديكيشن بيقول لك انا طالع عندي انا بعطيك الدواء ما له حق يعمل لك completely wrong. I don't agree. هيدي very important conflict بتعيشوها انتم بعدين بين تطور.
But this is getting
It's very common ونحن in a society that tell each other يعني it's a word of mouth that this is very
good. For
good.
the endocrinologist to give the protocol of
knowing that people are losing weight by
People are losing weight and everybody's been taking this. It's been going on هلا for a while and they're telling each other it's a medication. It's okay to take it and they're losing weight. So, and they pay it and they're getting
it. It's a question mark. But at the outcome result.
Side effects.
Outcome result one first. At the result outcome يعني is it really separate months or several weeks or after 2 years.
Exactly.
Completely different. The complication, for example, the thyroid problem or the cancer.
Maintenance.
There is a risk. Even rare risk, but it exists. بس أهم شيء conflict اللي عم نعيشه نحن كبارياتريك surgeon between endocrinologist and nutritionist. الendocrinologist englobe the role للnutrition it's completely wrong. هذا البروبلم. اللي بيجي بعطي بروتوكول انه خذ هيك كل هيك طبعا.
هلا sometimes it comes at the pressure of the patient. يعني كمان في culture انه اذا انت رحت عند حكيم اذا قال لك نام معلقه التليفون وكل احسن ومشي نص ساعه بالنهار انه رح يقول شوي عم تنصر علي اذا وصف له حبه دواء. Sometimes it's a placebo يعني حتى اذا الدواء حبه whatever.
And speaking of this, people when they want to evaluate dietitians, they evaluate them on the speed of the weight loss. يعني إذا هلا the most famous dietitians are those who consult the patients على very low calorie diet. We had an alumna
That's
from
it.
our program,
Oh.
and Nadine asked her to come to her office and gave her the lesson to start doing it, but she didn't, and she's now #1 dietitian in the country.
No, she's no longer. But no,
Ah.
at some point she was very
Influence.
and I was very sad. I mean, this is someone who's got a very good education, but this comes back to the problem of ethics.
Yeah. Very important.
So giving a person what they want to hear or what they want to see on the short term versus actually applying what you've learned and what is best for their health, etc. So I'm happy that this was only one. I've been at LU for 12 years, so just to let you know, we have a lot of graduates, but yes, this actually happened. And again, as George mentioned, it's about your role as a dietitian. You can absolutely not prescribe any type of medication. At some point, they were giving glucose diabetic medication because it affects appetite, and this can be very dangerous if your body doesn't need it. You can have a lot of side effects. So.
Maybe now with the NAAB, there would be a better, like even for psychologists, because this is very recent, there would be a better monitoring of what the market, the trends of the
shouldn't allow
market.
this medication to be sold without prescription. Now they're getting it from Egypt,
وهل كمان
from
we are
Turkey.
facing كمان problem pardon. We are facing problem. We need the signature of secretary, for example, to have to get approval for example insurance. We need من ضمن acceptance we need the signature of psychotherapy, which is very important.
Thank you everyone for being with us. Of course, we are almost and the nutrition faculty are easily accessible. Anyone who would like to ask, to inquire, feel free to email any of the nutrition faculty, and they will be more than happy to refer you to dietitians or to answer your inquiries without anything in return, because at LAU we believe that we have a mission to serve our community, and what we're doing today is part of it. So please stay in touch, feel free to contact the nutrition program for any consultation. Thank you.